This is the Hummelbaugh farm, Dr. Schrader.
It is. It is the Hummelbaugh farm.
This is a forward aid station, a bandage station, a dressing station.
A field aid station.
And you told us that we were going to a field hospital.
Yes.
So explain yourself, sir.
There's a number of reasons we've stopped here. You're absolutely right, Fran. This is a forward aid station, a field aid station.
Just like we left.
Only it's in a small structure.
Right.
And all the way up and down the Tawnytown Road, for those of you who don't recognize where you are, we're right on the east side of Cemetery Ridge along the Tawnytown Road. There were any number of forward aid stations in these small homes, and that's what the Hummelbaugh house is. The doctor who's here is doing basic first aid like Dr. Boylston Adams was up on the Stony Hill, but there's going to be a story to this. We talked about the second level of care being division field hospitals.
And that's where I thought we were going.
Well, we drove by some on the way here. Right. On the Tawnytown Road, right behind us, maybe a half a mile to the south, are 3 division field hospitals for the 2nd Corps. And they've been positioned there by the medical staff that was in charge of our 4 wounded soldiers, because they belong to the 2nd Corps.
Now, you and I, the first time we saw a field hospital, were impressed by the fact that nobody pointed it out to us in. But what makes a field hospital different than anything else?
Well, a field hospital is going to be where the medical care is rendered. And so it has to have good road access. It has to have a source for water. It has to have space to do what you need to do there, because there are going to be hundreds, if not thousands, of people wounded, brought to these hospitals. And as I said, you have to have a way to get them out of there. And so these field hospitals, division field hospitals, are set up as the fighting is getting started in locations that meet those criteria.
Now, this is part of Letterman's system, right?
Correct.
So you're going to be wounded on the field, maybe antiatherage helps you, then a bandage station, then you come
via ambulance to a division field hospital.
Division field hospital. Now, Letterman also has a different medical staff in the field hospitals, correct?
That's right. This is really where the medical staff is most concentrated. Like any good bureaucracy, there's a top down to bottom method of organization, and every corps has a corps medical director, and then underneath that there are a number of layers of people who are going to run this hospital. Chief among them are surgeons known as operators. Every division has their own operator, and may have up to 3 operators. And those are surgeons who are given that position because they're very good at doing the operations. You have to remember, most doctors at this point have never done a surgery, have never seen a surgery.
OB, fevers,
yeah,
kids sick, none of this type of trauma surgery, combat surgery for sure.
Right, exactly. And so these men were chosen not by rank, not by seniority, but because they had the ability to do the surgery the best of the people that were there.
And Letterman and Guild have kind of gone back to the Hippocratic Oath. I always say they've gone back. It doesn't matter what your rank is. If you're really good at fixing pelvises, this is your case.
Yeah, that's right.
If you're really good at taking off an arm, this is your case. I don't
right.
care if you're outrank somebody.
That's right. And
they're
so
finally moving to
they've got the best people doing the surgeries that are necessary. So when we think of a hospital, we're really, in the Civil War, we're thinking of a division field hospital. Okay. But I want to emphasize, these are often in open fields, often in barns, and again, no concept of bacteria for infection, no concept of a, let alone clean, if not sterile, operating environment.
And they're set up like a hospital you see today. There's an emergency room, there's an admitting room, there's a pre-op, there's a post-op, there's surgery, there are wards for sick patients.
Right.
There are certainly supply, we would call them supply places in the hospital. There are morgues for patients. So if you've been in a modern hospital, next time you see a sign that says field hospital, all you have to do is look around, and you've been to one. The only thing not there are administrators.
I know, administrators in the billing department.
In the billing department,
right.
insurance.
But this is not a division field hospital,
That's right.
so I guess
why
we
am I
need
here?
to explain that. This is set up as a field aid station. And quite simply, what happens on July 2nd, 1863 is that the division field hospitals for the 2nd Corps,
which the 148th is part of.
correct, quite simply get overwhelmed. They get overwhelmed with so many casualties that when you read the accounts and the regimental history of the 148th PA, this position, where there's one physician, basically gets morphed into a division field hospital because they start to do surgery here, we think, out of necessity. And the surgeon who's here is
Alfred Thorley Hamilton. He likes to be called AT.
AT. I would
be
too.
too. Yeah.
Yeah.
But he's in a forward aid station, so he's a new doctor.
Right. He's an assistant surgeon.
But he's not really a doctor.
Well, medical education before the Civil War is much more varied than it is now. And there are doctors that we think of today that we would term allopaths. There are also doctors who believe in curing diseases with water treatments. They're called hydropaths, and Dr. Hamilton is in fact a hydropath. Now, to his credit, he has attended lectures at allopathic medical schools. He's passed the licensing exam for the state of New York, so he's qualified to be here. But I dare say, I don't think he's probably done much in the way of surgery.
Right, and hydropaths they're stumbling into the fact that cleanliness is next to survivability.
Yeah, and actually, if in his career, he becomes much more of a public health physician than a practicing physician.
So he believes in water and clean tools. All right,
Yeah.
so now he's got more people here, and he's trying to send them back to, we believe, divisional field hospitals, and they say no more. That
Yeah.
never happens in modern life, does it?
Well, if you're ever put in a position in the civilian world, and I'm certain in the military world this can happen, where you have a mass casualty event, hospitals have to cooperate, and if your hospital is being overwhelmed, you just can't say keep bringing them in. That's not the right thing to do for the patient. So we term it, we're on flyby. That means that we've got to fly to the next trauma center. So I guess you could say that the Division Field Hospital for the 2nd Corps kind of went on flyby, and this man was pressed into doing surgery here.
Right. Now, originally, he doesn't have anesthetics, but he gets them. And how do you know that they're doing surgery here?
Well, there's a great account, again, by the person who wrote the regimental history of the 148th Pennsylvania, the unit that our soldiers came from. Let me read just a little of this. The overflow of casualties quickly spilled beyond the small house into the outbuildings, and then even out over the surrounding boulder-strewn pastures. Hamilton, in response to the backlog of patients at the division hospitals, Hamilton had greatly expanded the medical care provided here beyond its assigned duty of quickly stabilizing the wounded for removal to the hospitals in the rear. Adjutant J.W. Muffley of the 148th, hobbling badly after being struck in the left calf by a spent piece of a Confederate shell, discovered that fact in a most unpleasant way. During the night of the 2nd, as I approached the little house, now the field hospital, I stepped on something that felt so peculiar that I stopped and picked it up. It proved to be an arm. Happening to look at the west window, I saw an outline of a pyramid of some sort, which on examination I found was a pile of hands, arms, feet, and legs, which the surgeons had thrown out in their work and which now reached the windowsill. So limbs were being amputated here in this building and thrown out on the ground behind us.
Right. Now, we've said before, we've alluded to that. We research in a tome, the Medical and Surgical History of the War Rebellion, 90,000 surgeries. Now, one of the surgeon's duties here was to record. That's why we have this thing. There was like a scribe. All right, we have that.
Right.
So we also can tell you that he is not amputating here without using anesthesia.
Right. And so what we can't tell you is exactly how that connection was made, but surgeries were being done here, and if surgeries were being done, anesthetics were being delivered.
Correct. You cannot remove a man's leg, arm, limb if there's any sensation left in it. Now, if your arm's mangled and all the nerves are destroyed, certainly you can finish it with a pocket knife like Bade Wilson did. But you can't bite on a bullet, and you can't bite on a strap. You need anesthesia.
So tell us about anesthesia in the Civil War, because I think, again, most people have a misconception about this, Fran.
If there's anything these poor wounded soldiers were blessed with, was two great anesthetics. ether and chloroform. Now they use chloroform more than ether. Ether has that problem that it tends to blow up, and they're going to be working around the clock here.
Right.
Now I know from working in the OR, light is a problem. So most times surgeons operate outside. The light's better, but at night they're using kerosene heaters. You can see how that ether thing would kind of be a problem. Yeah, it's not a good thing to do. But those patients were put to sleep. Now a couple instruments. Now Jake, you cannot laugh at me because I don't have what you have, but they use this. They use devices like this. Thank you, sir. They used this thing, which was an ether funnel, chloroform funnel, right? This is my handmade one. And incidentally, the man that made this for me said the problem was how do you prevent this sponge from falling down? So I have to pull one of yours up to do that. But ether and chloroform are liquids that become gases. And before people say, oh my God, he's going into right field, every time you fill your car up with gas, you have a liquid, and when you put it into the tank, you see the vapors coming out. That's exactly how these things work. So you would either use a funnel to put it over, or you would take a 16 by 16 cloth, and I forget how to do it, but you would roll it in such a way that it looks like an ice cream cone. And the wide part would go over the surgeon's, would go over the patient's mouth, and then liquid would be dropped on top, and then that turns
So you would just drop it?
Open drop, yep.
Okay.
Yep. So the patient breathes these, and the exchange point is your lungs. Now we don't have IVs, but I'll tell you from my practice, the lung is actually faster than intravenous because it's right there. It's a huge area to exchange drugs. You do it every time you take a deep breath. Carbon dioxide goes out, oxygen goes in. And that system to move gases to keep you alive from your first breath to your last breath is what you can do with these vapors. And they go in and the patients fall off to sleep. Now we see lots of remarks, especially in the movie Gettysburg, when Chamberlain's brother comes back and goes, it's terrible, Lawrence, they're taking men's arms off over there without any anesthesia. That would be a common report. Unfortunately, anesthesia works like you do at night when you go to sleep.
Right.
You're wide awake, you're in that period where you're not awake and not asleep, and then you go into deep sleep. Anesthesia does that chemically, and it still happens today.
Right.
So we believe that a lot of these surgeries are happening out in the field like this, and the soldiers marching into battle or out of battle see their comrades having surgery, and they catch them in that period where they're not awake or not asleep. Now you know what it's like to be startled from a deep sleep.
Right.
That's exactly what we describe as hyperexcitability, and it's very common with inhalational anesthetics. Now today we get over that. We use drugs called Diprovan.
To stop that from being a problem.
Right.
So even though the arm is moving, the leg is moving, and somebody else has to help hold it down, they're anesthetized. They're asleep.
Correct.
And I will tell you as a surgeon, that's all the surgeon needs. We got hundreds of patients laying out here. I'm not going to wait until it's just the right time. Nowadays, I wait until you give me the high sign to go ahead because I don't want to cause a problem. But it's got to be done in a timely fashion in the Civil War.
And correct. Now, today, Rick will tell you, I have walls of monitors. I can tell you the oxygen coming out of your heart before it goes to the lungs. They don't have that. They have their fingers on pulses in the neck and on the carotids, and they watch breathing. The coolest thing about ether and chloroform is that they're administered by your breathing. And the deeper you get to sleep, you stop breathing. And when you stop breathing, you wake up. That's why in the 90,000 cases, we have, 70 to 90 deaths related to anesthesia, because you can't kill somebody on these drugs.
It's really amazingly safe.
It's amazingly safe. And what these poor wounded soldiers, they don't have IVs, they don't have blood transfusions, they don't have sterility, they don't have a lot of things, but what they have working for them is this. The anesthetics are surprisingly safe. You breathe in and out. The problem was the only way to tell the surgeon when it was time was when they would see the breathing slow down, because they know when the breathing starts to really slow, the patient's deep, and that's the point where I'd look at you and go, go.
Yeah.
How long did it take you to take a limb off in the Civil War?
Oh, in the Civil War, 5 to 8 minutes.
Right. So I'm going to let him take. But let me show you one thing, folks. Rick is holding that anesthesia funnel. The South uses a thing called a Chisholm inhaler. Don't laugh, Jake. It's an Altoid box, but it works. You have a fiber inside to take the liquid, but maybe one of the things people don't know is because this is inhaled, and the South did this because they're running out of these anesthetics, you still have to put the funnel over to concentrate it enough to go to sleep, either the funnel or a cloth to get it in. But what is really surprising, and I brought these with me today, folks, this is a modern anesthesia circuit that would attach to an anesthesia machine. Notice any similarities?
Yeah, it's triangular. It's a funnel.
It's a funnel, and this is a face mask. And
Right.
the other thing, I know the Civil War Museum has bottles of anesthetics, and they're life safe. They come in dark brown bottles or tin bottles.
Yeah,
Tin. So these are modern anesthetics. This is isoflurane. Notice the bottle, and this is
These are
Supreme.
empty.
They're empty. All right. They're still sensitive to light. And if you look really careful, this one is actually, I'm just going to read it because I like reading it. 1,2,2-trifluoromethyl difluoro ether. This is ether that doesn't explode. Yeah. So we're still using this stuff today. But that 5 minutes is kind of, I mean, I'd like if you could do surgery in 5 minutes.
Well, let me ask you this. Who's given the anesthetic, Fran?
I wish it was me, but it's usually people who can do it. I mean, Dan Sickles has a
chaplain.
A chaplain do it.
Yeah.
It's people because it's relatively that safe.
Yeah, yeah.
It's relatively.
So it's not necessarily another physician
Correct.
giving the anesthetic.
Correct.
It might be a hospital steward or somebody standing by.
Yeah.
Okay.
Yeah, doing it.
Great.
But the surgery takes 5 minutes. Man, we can't even get prepped in 5 minutes.
No. Nowadays, we're not hurrying, but I mean, if I had to do an amputation, it would take about half an hour to 45 minutes. But it's a different world, obviously, now. Do we want to go ahead and talk about the operation? You got anything else you want to say?
No, let's talk about
Okay,
that operation.
right.
Now, the other thing that I can do for Rick today that they couldn't do for them back then is that I have the capability to control 4 things. I can control whether you remember something. I can control pain. I can make you paralyzed so you don't move. Sometimes Rick needs paralysis. And I watch for reactions on my heart monitors because everything he does hurts a patient. My anesthetics are basically controlled drug overdoses. If he's not hurting them, getting their sympathetic nervous system firing, my stuff will kill you. Anesthesia is hours of boredom, moments of terror. And I always tease Rick, they pay me to wake you up,
Right.
not to put
Not
people
to put
sleep.
this, right.
Anybody can put you to sleep. They pay me to wake you up. But the surgery, how has that changed in the last couple 100 years, 158 years or so?
Well, it's obviously become more complicated, but the decision making that leads to the surgery, again, it started out at the field aid stations. In that subgroup of surgical patients who an operation can help, the operation that can be done and is done commonly is an amputation. But first, there's an assessment of the patient's injury. And many times that's in consultation with not just the one operator, but other doctors. Does this need to come off? How can we save the limb? Now, I'm sure time has a lot to do with that when you're overwhelmed with numbers, but I will tell you, when General John Bell Hood's elbow is injured out near the Bushman farm, he doesn't undergo an amputation because 3 doctors look at that and say, we don't need to amputate that. It is possible to do an operation called a resection, where you remove part of the damaged bone but leave the extremity in place. That works if the nerves and the blood vessels are still working. If the nerves and blood vessels are damaged, the limb isn't going to work. And the vast majority of surgeries that were done were amputations. Now, if I was getting ready to do an amputation in 2019 and 2020, if you walked into my operating room and I had a picture on the wall of a Civil War surgeon's amputation kit, it would look a lot like what you see in the picture. We use a lot of the same instruments. This is an amputation saw. There are many different types of these instruments, and if you go to the museum, you can see very good examples of amputation kits. I tell people the biggest difference in modern medicine is we have a battery on this saw now so that I can just press a trigger and we can cut through the bone. But we use the same types of amputation knives. Basically, it's about a 3-step operation. You cut down to the bone, you cut through the bone, and you take a big, long amputation knife and go down and out and take the leg off. And then you hand it off to somebody here to throw out the window, I guess.
Now, tell me about that, though. You've told me before that's a surreal moment
Yeah,
in the operating room.
I was just actually talking to an operating room nurse that I worked with. I had her on tour, and we were talking about amputations and that very unusual feeling of taking a limb and handing it to someone else and them receiving it. I'm sure here there's no thought given to that because, again, there are a lot of patients that have to be taken care of. But an amputation in 2021 mechanically is done pretty much the same as it was here at the Hummelball farm.
But with sterile instruments.
Well,
You're
now,
not-
yeah,
you're not blaming-
yeah.
And the other thing that I would say from the anesthesia point of view, probably none of these soldiers here that needed surgery today would make it to the table in the first 24 hours because they would need to be tuned up. We work differently now in trauma. Maybe the amputation will happen, but other stuff has to happen first. Patients now are screened medically.
Right.
And sometimes Rick goes in and just says, just stop the bleeding. We got to handle A, B, and C first before we move on. So there's multiple, even though there will be multiple surgeries here, I kind of get the feeling this was a definitive procedure in their mind.
Yeah, I think so. I think so. Now, there were some pretty famous people
Yes.
treated here. One in particular.
Yes. So let's talk about William Barksdale. I don't know if your viewers know William Barksdale.
I'm sure.
But William Barksdale is treated here. He's a Confederate general. He is wounded. Like I said, Rick and I look for primary source documents, and the primary source documents from Alfred Thorley kind of change history a little bit. And some of our friends who are historians, when I read what Alfred Thorley say, they go, no, that's not true. Most of us believe that William Barksdale was shot and that there was a gaping wound under his left breast. Now, I work in a trauma center, and we have A.T. Thorne and I have trauma surgeons, but here's what Thorley said. His picture's here some way. I attended General Barksdale from Mississippi. Honest to God, I feel bad for him. They always refer to him as Portly. Portly General Barksdale. He was shot to the left breast, and his left leg was broken by 2 missiles. He was brought by some staff to my temporary hospital. I gave him what I had to relieve him. He asked me several times whether his wounds were necessarily mortal.
And this is Dr. Hamilton
This is
talking
Hamilton.
to Barksdale. Okay.
And I told him that, and he desired peace, but only terms that would recognize the Confederacy. Now, he was a large, corpulent, refined in appearance, bald in his general physical and mental makeup, firmness, endurance. His perceptions were quick, but he did have an issue going with General Barksdale, and the soldiers that brought him in said that. First of all, Barksdale's talking.
Yeah.
Meaning
so he's got to be moving
air through his vocal cords.
Right.
But when they give him water comes out this left gaping wound under his chest.
That's a problem.
Which would be his esophagus.
Right.
I mean, we used our esophagus every night and morning when we have breakfast and coffee. So that esophagus has to be tore. And in the chest, they kind of go down the same area.
Right, they're right next to one another.
Right, so he can talk, but he's got fluid coming out. And that's kind of always mystified Rick and I a little bit. But here is what he says here. Confederate politician. His wounds, this is Thorley talking again on further examination, his wounds in his foot, and there was a large gaping wound from behind. And people go, huh? I go, yeah, he was shot from behind. They go, wait a minute, large gaping wound under the left breast, but when you read the 148th, oh, that's a tome, huh?
Yeah,
That's bigger than a Fawn's book. He says there, a large gaping wound under the left breast from behind. Well, now that starts to explain a lot. And when you go to the trauma surgeons and say, okay, I've got this portly guy. He's got a large wound under his left breast. He can talk, but when he swallows water comes out in his chest. And the first thing they say to you is the wound under his breast is an exit wound. So Rick, I need you to turn here. So here's what we're thinking. We're not taking anything away from General Barksdale. Men get shot in the back all the time, even by friendly fire. But we know those lead mini balls deform. We're pretty certain that that bullet came in the back, hit this big clavicle spine,
rib
area spine, deforms, and it makes a turn, and it comes out this way.
Right.
It deforms it and comes out this way. That explains a large wound under his left breast. It's interesting it's not reported that way, and that's for everybody else to figure out. But for us, Thorley gives us that primary source document, that it's an exit wound, not an entry wound. And even some renowned historians argued with me till I show them in the book, and they go, oh, it does say from behind. He's buried here, right?
Yeah, he's buried. He dies in this building along with one of our 4 soldiers from the 148th who's brought here after his death out in the wheat field, Captain Forster. And Barksdale and Forster are buried together with a 3rd unknown Confederate. And eventually their bodies, all 3 of those bodies are exhumed and taken elsewhere for burial. But Barksdale is probably the best known
Right.
person to be treated at this
Right.
field aid station / division field
Field
hospital. Right.
So since here, do you want to go over the other guys, or what do we?
Yeah,
wanna-
why don't we,
Okay.
let's bring these guys up to date as
Okay.
to what's happening with our other injured soldiers.
All right,
Captain
so here we go.
Forster's dead.
So again, we're not saying they were done here. So this is James Bills. This is our 18-year-old Rick. He was seen out at the Rock.
Right.
A tourniquet applied, bandaged, and the ambulance brought him here, and his surgery is going to be an amputation of the upper third of the arm. What would that look like?
The upper third of the arm, it would be about 2/3 of the way up the arm. That's a very survivable wound, but I would just say when you do an amputation in the Civil War, the closer you get to the trunk, the more likely it is that complications can be fatal. But certainly you're much more able to survive an upper extremity amputation than a lower extremity amputation.
Right, and extremities were by far the majority of them.
Right.
Right, and Barksdale's wound, he could have survived, and he probably would have survived today.
Nowadays, yeah, that's a pretty bad wound, but he could have been.
Yeah, he would have
possibly
survived.
saved,
We'd
right.
have put a tube into his stomach and fed
Right.
him. That esophagus probably not, but he would have survived. All right, so that's him. This is Jack Bayard. Now this is the one is kind of cool. Company H. This is the guy that's wounded in the hip. So I
Yeah.
think he gets here. What do you think the surgeons are going to do with him? Probe him, look at him?
You know, with a wound in the hip, if it's up into the hip socket and into the pelvis, you can't do an amputation of that. If the hip wound is down in the upper thigh, like again General Hood suffered at the Battle of Chickamauga, you can do a high amputation. But most of these, if they're in the pelvis, all you can do is pack the wound and monitor them for infection, which we should say 80% of these patients get infected because there's no antibiotics. I'm amazed it's not 95 to 100%.
But would you say that if he's bleeding, it's not as bad as some of the ones we've
If
seen?
he's survived to
here.
yeah, then because if he's shot in the pelvis and it hits a major blood vessel, he will bleed to death.
Okay. So how about our man that's shot in the liver?
Yeah, well, he's shot around the liver. Again, being shot in the liver is not an injury that's compatible with life. And if he's still getting through the system, then I think that speaks against a major injury to the liver itself. I guess what I want to emphasize, Fran, is we've brought the patients to the second tier of Jonathan Letterman's evacuation plan.
Now, normally, what happens after this? Where would these guys, the ones that survived, gone afterwards?
Well, one of the things that Letterman was very specific about was not moving these men too soon. In fact, he discouraged families from coming to take their loved ones home for a period of time. Eventually, when they were able to be transferred out of the division field hospital, they would go to the third and final level of care that Dr. Letterman had arranged and taken to what's called a general hospital. And a general hospital can be a brick and mortar hospital. There's a large one in York, Baltimore, Washington, D.C.,
Chimborazo in the south.
Chimborazo in Richmond. But there's a large general hospital that's created here at Gettysburg, again, for those soldiers that were deemed too unstable to put on a train and take out of town, or put in a wagon and taken down to the railroad in Littlestown. And that becomes the final stopping place for many of the soldiers.
Yeah, so they'll go, normally they would go from here to a big city, general convalescing hospital, but here at Gettysburg they'll go to a temporary general hospital.
Right, exactly.
Then to a general hospital
yeah.
because there are so many. Now, this is a cool place AT has for his hospital, but this place starts to become a problem on July 3rd, does it not?
Yeah, one of the problems that's faced by the Union Second Corps with their division hospitals along this road, the Confederates get pretty close on the evening of July 2nd, and I can't imagine this scene, but these 3 division field hospitals on the Tawnytown Road behind me have to be evacuated and moved in a couple of miles further east just to get them out of range of the Confederate artillery. And this is a map of modern day, the outlet mall basically area. Here's modern day US 15. And this collection of hospitals is now out there where they've been moved to. So it's been a great deal of work, but a lot of confusion going into this as they try to keep these men safe.
So, I mean, think about what's happening here. Thorley will come back and he'll walk this field and he'll walk into the barn that we can see behind us. And he describes a soldier on the night of his terrible night here. And he says he was alone here till the evening of the 3rd almost, to the evacuation, doing surgery. But he describes a man that was seeking a place of refuge, and in the barn he found a corn crib that he could get up in and he could rest. But that crib is going to be hit by Confederate fire on the 3rd, and the man will be blown to pieces, he says. And when he walks into the corn crib, he takes a deep breath and puts his hand on it, and he recalls that man. We talk a lot about here at Gettysburg, like Rick and I have told you, that they're not just lines under a map. They're people that you can feel and remain when you're here.
Let me close this part of our talk about division field hospitals with just a brief reading of what these men went through and what surgeons saw here. And this was also a soldier in the 148th, the same unit we're talking about. A young soldier, a mere boy, who was brought to the hospital carried on a stretcher while a soldier walked alongside with his hand, held a wound in the thigh near the body. He, the patient, said he was entirely free from pain. A surgeon examined the wound and said, "Nothing can be done for you. You must die. If you have any word or message to send home, attend to it at once. You will die within a few moments after your comrade takes his hand from your wound, and that must be soon." He asked for paper and pen, which were quickly furnished. He wrote a letter to his mother, stated his condition, and that a comrade was holding the wound while he wrote to her, saying that as soon as he finished the letter, his comrade would let go and he would bleed to death in a few minutes. The letter was finished. He let himself fall back, hesitated a moment, and then said, "Now you may let go." And Levi Smith of Company A, 148th PA, who held the wound, withdrew his hand, and in a few minutes, life had gone out. That's what these men are often going through here.
Correct. Correct.
Thanks so much for watching. Really appreciate it. Thanks again to Rick and Fran for helping us out with these videos. Subscribe to our channel to stay up to date to the latest videos. Become a member of the National Museum of Civil War Medicine if you want to support programming like this, and we'll catch you in the next video.